Hi everyone, welcome to Teddy GSU channel. How are you all? I hope you are fine and safe. So this is Harshita, a second year medical student at Carteru Medical College, Guntur. So today we are going to start the classification of pharmacology drugs. So this classification is very important, and this is the basic and the most important thing that you should know in your second year MBBS. So let's start the saga of classification of pharmacological drugs. Okay. So first let's start with the cholinergic drugs. So first, these cholinergic drugs are divided into two subunits depending on whether they are cholinergic agonist or anticholinesterases. Cholinergic agonist or anticholinesterases. And these cholinergics are further divided into two types. First one is choline esters and the second one is alkaloids. Okay, it is important to know the drugs. Choline esters. So we are going to learn in A, B, C. A for acetylcholine, B for bethanol, and C for carbachol. Okay, so this is the mnemonic for choline esters. And second one is alkaloids. In these alkaloids, MAP, M-A-P. M for muscarine, A for areocholine, and P for pilocarpine. Okay, make sure you remember these all. MAP and ABC. Okay, and the second one is anticholinesterases. These anticholinesterases are again divided into two types depending on their reversibility, whether they are reversible or irreversible. If they are reversible, they are further classified into two types. First one is carbamates and the second one is non-carbamates. Remember them with a mnemonic called PEN. P-N. P for physostigmine, N for neostigmine. Okay, and for non-carbates, DEG. D for donepezil, E for edrophonium, and G for galantamine. And the last one is irreversible. In this irreversible also, they are divided into two types, same as reversible: carbamates and organophosphates. Organophosphates are very important. These organophosphates are very important, and these we remember with the mnemonic called as CP, personal computer. C for carbyl, and C for propoxyl. And this is M for melatonin, E for echothiopate, and D for diphlose. So this is the classification that one should remember for their cholinergic drugs. Okay, let's summarize this. Cholinergic drugs. This is very easy to remember. Cholinergic drugs. C. First, they are divided into two types: cholinergic agonist, like they are similar to the cholinergics, and anticholinesterases. Okay, these are divided into two types: choline esters and alkaloids. Choline esters means A, B, C. A for acetylcholine, B for bethanol, and C for carbachol. And alkalides means alkalides. MAP. How? Muscarine, areocholine, and pilocarpine. Okay, and these anticholinergics again divided into two types. One is reversible and the other one is irreversible. These irreversible and irreversible are again further divided into two types. They are carbamides and non-carbamides, and irreversible is carbamides and organophosphates. These carbamides are PEN, like physostigmine, neostigmine, and non-carbamides are DEG, like donepezil, edrophonium, and galantamine. These carbamides of the irreversible are of two types, CF or PC. PC means personal computer. You can remember is like that. Propoxyl and carboxyl and MED. Organophosphates like melatonin, ecothiophat and deflux. So in this class I am just discussing about the classification, and in the next classes I will discuss the importance of the drugs, side effects of the drugs and mechanism of the drugs of choline esterases. So if you like the channel, please consider subscribe to the channel Teddy Guides You. This is K. Harshita signing off. Thank you so much.